Aging is something we, as a group of people, we don't like to talk about what will happen when we are older, what will happen when we are 60, 70, 80, or 90 years old. But a lot of research and even scientists are saying that it's a very likely even that most of us, at least a lot of us, are going to survive till the age of 100 or 120 even. But then again, in today's day and age, people are getting their lifestyle diseases like diabetes or hypertension or high cholesterol, heart diseases, strokes, cancers. All these are products of our today's lifetime, and people are getting this younger and younger. And it's simple logic that the time you spend having these abnormalities or this disease will matter. And like the longer your blood sugars are high, or the longer your blood pressures are high, or the longer you have high blood cholesterols, the chances of you getting a complication from this is also higher. So we have to take an action. What do you have to do? You have to reduce your chance of getting these diseases by following a healthy lifestyle. And it's not just about eating healthy and exercising. Everyone knows that you have to do eat healthy and you have to exercise when it's not a rocket science. But there are other things like biomarkers and blood tests, physical tests that you can do that will let you know that what exactly is your requirement if you want to keep your body healthy. And that is where the idea of a longevity clinic came to me. So I was also a regular doctor practicing medicine, like I was taught in medical school. Then one day I came upon this book called Outlive by Dr. Peter Attia. And reading that book was a revelation, because in that book, Dr. Attia talks about how the medicine we practice is medicine 2.0. That is, we are just treating the diseases. But right now, we have the facilities to prevent these diseases. Or maybe some of those tests are a bit expensive, and some of those tests even I was actually not aware of these tests, and general public will have no idea how to get it done. So when I first read about the tests like LPA or ApoB and all, I had read about it in tests, but I really didn't know when to use that. Those are all high profile tests that maybe some advanced tests the cardiologists do. But when I read more and more about it, I realized that these are tests that you need to know to understand your risks. So that's just one example. And I had no idea where to get it done. Similarly, VO2 max. So a lot of watches now calculate VO2 max, but how to properly calculate your VO2 max or a strength assessment? I mean, I've never seen a hospital do a patient's strength assessment, but it is really important to know how strong their muscles are so that they can work on their weak points and start making their body healthier. And it also made me realize that even me, my parents, my husband, my in-laws, we're all people who tried to live a healthy life. But then again, we would do routine checkups, yearly health checkups, and something or the other will come out to be mildly abnormal. Like my mother had some diabetes, my father has some BP, or my husband had some cholesterol. Not nothing over the roof, but it's still abnormal. And we've been following some good lifestyle change, I mean, eating healthy, working out a little bit here and there. But then I realized that that's not enough. You actually have to make the priority to normalize all these parameters in your blood and your body so that you keep your body healthy. Because your body is the only thing that you have that you can really maintain. I mean, you can invest in an FD or maybe in an SIP, but what use it is after 30 years if your body doesn't have the energy or the strength to enjoy your life. So we made changes. We made this lifestyle changes. We started exercising more holistically, like what our body wants to do. And we monitored our biophysical parameters, and I started noticing changes that I didn't even expect. It's not just that doing these healthy lifestyles or this stuff keeps you healthy in the long run. You actually start noticing changes in the immediate term. Like your energy level starts going up, you start feeling more energetic, you start feeling more your sleep gets better. You have maybe you want to do more stuff because now you are more healthy, and you start to enjoy stuff more. So I realize that it's not something that you have to do to just be healthy after 50 years or 30 years, but to enjoy your life right now, you have to keep your body healthy. And then I realized that there are very few opportunities for people to do this stuff here right now. I mean, a lot of people are now interested in being healthy, and they are all trying to get information on healthy eating, healthy diet, healthy workouts. But the information out there is chaotic. There is a million videos on YouTube or Instagram about how to eat healthy. But most of the stuff was just not true. And it's even people who are eliciting scientific research are they're picking and choosing whatever fits their narrative. No one is actually really getting a concise true idea of what to do. And even if someone has some idea, they have found their good sources and realize that they have to do it, there's not enough facilities to do these things. So that's when I realized that I need to do this. I need to have a facility where I can help people increase their longevity by doing the stuff, not the medicines, but the physical stuff, doing the preventive health checkups the right way. Because regularly, how do you do your preventive health checkup? You'll go to some lab or maybe a doctor, and they'll write a few tests, yeah, basic things, basic tests, maybe some even advanced tests. But really, is that enough? Is some blood test or an ECG? What does an ECG even tell you? ECG is like a snapshot. So right now your heart is working fine, but you don't need an ECG to see that. ECG is relevant only if you have a chest pain. You might need to do a treadmill test or even a coronary calcium scan to realize if there is a block inside your heart. But how do you go and do it? Or where do you go and check your VO2 max? So that's when I decided that I have to do this. So here at Vitalis Health, we help people manage their lifestyle diseases and prevent them even before, because we have to start early, and we help develop personalized tests, including your body composition, your VO2 max, your strength, and your cardiovascular and metabolic parameters, your cancer risk. We compile all these things, and based on your personal risk, based on your family history, your personal risk, we calculate the risk scores for you. These lifestyle changes are not for a year or two, not to treat your diabetes or your blood pressure. This is to make your body healthier so that you can live longer. And we frequently, routinely monitor, maybe once a year or twice a year. That is depending on the patient. We monitor the risk factors so that we can detect something with the very earliest possible stage so that it doesn't go on to cause some trouble. So that is the idea and the story of Vitalis Health, and I hope to make a change with this. Hope you can visit soon. Thank you.